good.
They're probably hypersensitive to
Yeah, well,
symptoms after their experience.
yes, for obvious, understandable reasons.
What I don't understand is why y'all didn't change your budget.
Should we have asked for more?
No, I didn't say more.
Okay, all right, well, if you just want to go ahead and open the can of worms.
It's just not like reasonable, keep it the same.
What do you suggest?
No, you don't want to do it.
Don't have that.
Yeah, don't
Open
go
the
there.
can of worms, or can I go?
Have to, some of those other ones.
You're the only department that gets garbage picked up, I think, so I have that to complain about, but you all have a special need, don't you?
Y'all can probably only dispose of that. Y'all can probably only dispose of things certain ways.
It is.
Yeah.
I noticed his electricity is kind of gotten about the.
It was quite a bit higher for the last 12 months. I guess my question is, if the most recent 12 months electricity was basically $12,000, is it realistic to budget $8,600?
Yeah, that's really a good question.
That 8,600.
And I wasn't going to recommend an increase,
Well, I don't want
But it
to.
makes
I
sense.
don't want to have something we know is
no,
not be.
I agree, it makes sense, sure.
Unless there's some reason we can expect electricity usage will go down.
Well, is the learning center next door, is that separated as far as utilities, power?
Well, there's 2 meters.
That's a good question.
If it is, I mean, we don't have a learning center budget. If it's not included in the health department budget, it's maybe included in DJ's, but I'm guessing that it's probably, since that's the same building, I'm guessing it's probably included in this one.
But do we have any reason to expect that the electricity usage would decline?
I don't know. I just can't figure out why it would have gone up unless the rates have gone up or something.
Yeah, this coming up 4,000, oh, well, 3,000.
That's why I was questioning the other facility, if it's combined, that might be the.
I would say that the learning center and the health department are probably together.
But
I can.
there wouldn't have been that much change between either one, though, would there, over the year?
Whether they're, I don't know, but whether they're together or not, I mean, it is what it is.
Yeah.
We're not gonna cut out the learning center.
Right.
We
How
gotta
are we
do-
tracking year to date, Sandy? Do you have that figure?
Through the end of September, we're at 85,
Yeah, so
so it probably
it needs to be brought.
probably needs to go up a
Because
little
we got a
bit.
new HVAC unit. When was that? Was that like the budget before? Didn't we get an HVAC unit on that building at some point? There was something wrong with the near.
It wasn't last year.
But at 15, maybe 15.
Might have been a long
Okay,
time.
it might have been. I was just here thinking maybe that was a contributing factor somehow.
Really, that should have brought it down.
Yeah,
If anything,
exactly. That's why I
Because
was-
newer should be more
More
efficient.
efficient. Yeah, okay.
It looks to me like, much as I hate to say it, we should make that electricity.
Well, yeah. Now, does that include anything within the courthouse allocations?
No,
Okay.
that would be just the health department building and the hospital, the learning center. And they did not request an increase on their, the monthly amount that we send them every month. So,
What's on that net increase of $900?
Tell me one more time, because every year I ask this about the other contribution line and how that process works.
You know, like the great name.
Yeah, well, you've got 147,000 a year that we budget. It's called other contributions, but
I think that's that check that we sent.
How do we do that?
That's just we send 12,000, well, for 2016, we send $12,257.62
to,
to the health department. Or to, I don't know if it comes straight to y'all or if it goes to the, yeah, it goes to the district
and of
office.
course, all your labor comes from the state, doesn't it?
It's a,
We don't have any labor wages in here, in this budget.
it's a combined, I don't know how to put it, other than it's a combined effort. We're state employees in terms of benefits, but we're actually employed by the Gilmer County Board of Health. So our budget is the Gilmer County Board of Health budget, which is allocated through our district office via the state, through state mandate, through grant and aid. It's all based on a formula, population and need within the county, based on our revenues. And then the contribution, county contribution.
But whatever portion of salaries that the county is paying would be attributed in that other contributions, and that check was in every month, right?
It goes into one big pot.
Yeah.
Mhm. Yes, and so what we do is, so I'm the environmental budget, she's the clinical side, and for our sake of keeping up with paperwork, we separate them so we can kind of monitor line items. So we can watch, I can watch my revenue, she can watch her revenue, I can watch my numbers, and she can watch her numbers. But as far as the revenue side, which is a big part of it, it all is allocated and budgeted out through our district county department.
And I guess my point is that we wouldn't have anything separate coming along for those salaries. It would be, it's
Right.
already accommodated.
Well, we don't show anything for revenue either, though, anywhere.
We don't collect revenue from that.
Y'all get revenue, but we don't collect it. I mean, I don't know where that goes.
It goes it's part budgeted as part of how we, so this percentage, the county percentage, as part of the bigger pot of what we spend for our entire budget, for our entire operating budget.
No, I'm saying, we don't have any revenue coming in our budget.
No,
No.
it goes into the big pot that they have to then come directly to us.
It probably comes to us in a roundabout way in that the revenue that they collect offsets probably a portion of what we pay them every month in our contribution amount.
But it's unlike other departments that the revenue comes in the general fund.
Right. You know, if they didn't have any revenue, you know, if they didn't have any revenue at all, our contribution was probably
Much more.
much more than it is.
Right.
And y'all don't do it like the other departments would do, or some of the judicial people, where we get reimbursements. It just doesn't work that way. I don't understand why, but
The only judicial that we get reimbursement from is the juvenile court. We pay reimbursements, like we pay
for other counties.
to, you know, back to the state for
Or
like
to the
public
state.
defender and district attorney and those kind of things. The only reimbursement that we get for any of the court facilities or court operations are juvenile court
Okay.
payroll.
Y'all got any changes coming up? State law changes that affect you?
No,
Everything's the same from,
Or federal laws that affect you?
no, for us, it's the same.
it's all the same.
That's amazing.
Yeah. Just hold your breath 1 year.
I was gonna say, you haven't missed something, have you? Because that's unusual or unexpected.
It's kind of been quiet.
When did the other public health certified, whatever, Obama, whatever, come into play? When did
You
that
mean the
start?
federally qualified
Yeah,
ones?
those people.
I said it was 2 years ago, so we've not had Title X funding for 2 years. And I think they may be exploring trying to reapply for that, but at this point, I think we're happy with actually not having that funding. So it's affected our numbers a little bit, but our revenues have offset, because since we don't have Title X funding now, we're able to collect to where before you could not ask for payment for services, and now we can. So we're actually, like in the current situation, better than before.
Right, okay. But they still exist.
They do. Georgia Mountain Health is a federally qualified clinic. And in the beginning, we saw a trend where a lot of our patients were going there, but now we're seeing the trend where they're coming back. So they like our services, and we're easy to get in with, and don't have a long
You're
wait.
more friendly, I know.
Yeah,
I've heard that
so-
over and over and over.
So they, you know, so we're seeing those patients
Two
right
things.
now.
One, I hear people don't know about them, and secondly, when they do go, they are not happy.
because they see other things, you know, I mean, when you come see us for a family planning visit, you're there with a bunch of people being seen for family planning. There, if you go during flu season, you've got to be seen after the 20 people that are there for, you know, to be seen for flu. So, and then there's a couple other little catches that they have that make it a little bit more, not as customer friendly, I guess you could say, is what we do.
And I guess are the charges based on, like, if you have a client that can pay $5, they pay $5?
For us,
Yeah.
well, right now, honestly, it's still based on income, so we have a sliding scale fee, that we do. We've never denied services based on ability to pay. However, we have changed to where we are now saying, okay, let's set up payments. Your bill is $50, can you pay $10 a month? And after they go so long without paying, we're being more aggressive with collection. We don't turn them over to collection, but we are trying to get that money. And we have seen our revenues go up, even though our numbers have slightly gone down, our revenues are going up. So it's kind of offsetting.
I don't have any other questions.
That's all I, that's all I have.
I don't have any questions.
I think changing that 12,000 is the answer. Makes sense, I mean,
All right.
Thank you all so much, we appreciate it.
Thank you.
Good to
thanks
see
for
you all.
coming.
The rest of the day.
All right.
Tell Johnny hello.
I'll do that, thank you. You're fine. See you later.
We don't have probate till 10:30. So there's some other discussion that y'all want to have to do in space, we could go over ours, or some of the non-departmental items or response, whatever you want to do.
I haven't had much time looking at any of this. Where are we overall?